That's the million-dollar question. At the whole SOPD meeting, we were looking at, do we build algorithms? So Dr. Klaus Roburn was looking at some of the data from Dr. Gravas, looking at predictors of how do we pick the guy who's heading in the wrong direction, and looking at some of the work with Dr. Wayne Quang. He is someone who's looking at preservation of the bladder, defenders of the detrusor. So he was one of our speakers and spoke very passionately about getting involved earlier and preserving bladders. And we're always so focused on the prostate. That's the million-dollar question. Are we getting to bladders too late? Are we waiting for people to have those Hiroshima moments where they got a catheter in place, they go to the emergency room, there's false passage, they have renal failure, they have stones. We failed those patients. We didn't get to them soon enough. So that's the question: is what are the biomarkers? Is there urinary assays? Outside of having these soundable technologies, perhaps administered with some of these point of care ultrasounds. So in my practice, I use Clarius ultrasound. So with regards to the follow-up of patients, how great would it be to have the ultrasound devices that we have in our office? Small. This is a second gen. There's a third generation Clarius system where this links up to your phone. So you not only can tell the size of your prostate really quickly, you can see what's left over. You press a button, it does an AI bladder scan for you. That you can do this periodically once a year. That why can't primary care? Why can't these be at drugstores or in patients' access that they can do this non-radiation simple procedure that can kind of like when you watch your kid go through puberty, you see the changes and you can get in there earlier. The problem is patients aren't feeling their own prostates. Not all primary cares are doing digital rectal exams. This is not a great tool for measuring prostate size. So, we need to know our numbers. So patients can get to know their numbers better, be it through technology on, soundable devices, ultrasound. I think that's going to be, to me, the greatest, most easy, keep it simple technologies that will get us there earlier until we get biomarkers that are going to be able to help us predict who genetically is going to be a grower. And then to really get to the essence, which questions all urologists, is why does this happen, doctor? And we know we give them 5 ARIs and that kind of medications to shrink or relax their prostate, but the essence, and we touched a bit on the work of Dr. Helfand and as well some of the work with Klaus Roburn and his team of some of the genomics and growth factors perhaps responsible, and its association with metabolic syndrome. So losing weight, exercising may also have some role in this. So that's a big picture of overall health, men's health, and our future that we still are, I think, still young at, and there's a lot more work to go.